What happens if you miss a dose of your GLP-1 medication? That's what we're going to talk about today. Hi, and welcome to my channel. I'm Dr. Megan. I'm a board certified physician in internal medicine, lifestyle medicine, and obesity medicine. And this is really important because I actually talk to patients about their weight all the time. I actually prescribe these medications all the time. I've helped hundreds of patients lose weight, and I'm here to help you too. So if you're confused about your weight, if you have questions about weight medicines, and if you want medically based answers to your weight questions, you are in the right place. So today we're talking about what do, what happens if you miss a dose of your GLP-1 medication. And there's so many reasons why this could happen. Maybe you're traveling, maybe you forgot, maybe your pharmacy ran out, maybe your insurance is giving you some pushback, maybe you have a surgery coming up. Like there's so many reasons why people would miss a dose, and let's just go over what happens and what to do about it. So basically the thing to remember is these medications last a while in your body. Well, two of them actually last. So tirzepatide, which is Zepbound and Mounjaro, and semaglutide, which is Wegovy and Ozempic. They last 5 to 7 days, the half-life. So they're like half of it is out of your system. That's what I mean by half-life. Half of it is cleared from your system. Wegovy, it's 7 days. For tirzepatide, it's 5 days. So it takes a while for them to ease their weight out. Now, liraglutide is different. Liraglutide, aka Saxenda or Victoza, that is a daily medication. And so the half-life for that is a bit quicker. The half-life is 13 hours. So that's going to be out of your system a lot faster than the other two. But the short answer is nothing terrible happens if you miss a dose. It's not like if people are on a blood thinner and they miss a dose. Like, it's not like that. So for my patients, like if I have a patient who comes in, they usually take it on a Friday and then they totally forgot over the weekend. They had people coming in from out of town, or they were hosting, they were doing something. And then they'll message me and like, oh, it's Sunday. Can I take my medication? I'm going to tell them, yes, just take your medication. And you can either switch to doing every Sunday now, or you can just give yourself a one-time dose. It's a little bit earlier. You could do that Saturday or that Friday, depending on what their side effects are like. You may want to kind of ease into it, or they may want to just adjust to a new schedule. Now, if I have a patient who has a colonoscopy or a procedure, usually it's at least a week that they have to be off of the medication. And so they can skip a week, and then I will tell them, okay, just go back on it as soon as you can if they've just missed one dose at the regular dose that they were on. So let's say they had their colonoscopy on a Monday and they missed the whole week before that. And then they could just take it on the Monday or the Tuesday when they're done, as long as everything's okay with their gastroenterologist and they don't have an issue with that. So missing one, if I have a patient who misses one dose, I will just tell them, resume it as soon as you can at the dose you were at. If I have a patient who misses 2 or more doses, it really depends on the situation. So if I have a patient who's missed 2 or more doses and they had a lot of side effects and it was really kind of a lot of work to get them up to that, I may tell them, depending if they have this in stock or if it's easy to get, I may tell them, hey, let's just back it down 1 level or 2 levels. Like if they were at 10 of Zepbound, I might say, hey, let's do 7.5 for a couple weeks and see and ease you back into the 10. If they had a lot of side effects, or I might back it down more. It really depends on the person. Sometimes what happens is the issue is more a supply issue. And so there are all these shortages that happen from time to time, as you all are very aware of if you're on one of these medications. So if there's a shortage and I really can't get them anything sooner, then sometimes I will say, okay, if you were on the 10 and it's been 3 weeks and they don't have a lot of really severe side effects, let's try going back on the 10 because that's just what we have. and we'll just kind of brace for impact. You might have more side effects, and then we'll develop a plan on how to deal with that. Like maybe they want to take it on a Friday, maybe they want to have some Zofran on hand or Imodium or whatever kind of their side effect issues are. If it's more of a supply issue, then, I mean, this is always very much a discussion between me and the patient. And so I have some patients that are like, you know what, let's just do it. I'm jumping in both barrels. It'll be fine. I'll deal with it. And of course, this is always, in the setting of people who I don't have really serious concerns about, like a small bowel obstruction or, nausea that we can't stop, or, it's an appropriate candidate for this. But yeah, sometimes we just go, if they've missed 2 or more doses, we start back at the same amount, especially in those shortage cases, and just hope for the best, but plan for the worst. Again, this is always a reason why it's important that whoever is prescribing these medications for you, that you have a physician that is monitoring you and that you can reach out and ask questions to, because these things come up from time to time. You're on these medications for life. So not every week is going to be a smooth week. People travel, they forget. Again, a lot of reasons why this might come up. But just another reason, just a PSA in terms of making sure that you are being monitored appropriately. That's going to do it for today. Thank you so much for watching. If you have questions, definitely leave them down below if you want to work with me directly. I do work as a life coach to help people with the non-medical aspects of their weight. So exercising consistently. If the food noise comes back, what do we do? All these types of things I help people with as well. If you want to work with me directly, I'll leave that info down below. Thank you so much for watching. And if you're not subscribed to my channel, subscribe, because it's the place for medically based answers to your weight questions. Thank you so much, and please be well.